A new COVID variant has surged by 147% in just 9 days across multiple U.S. states. Hospitals are reporting the highest wastewater viral load since late 2022, and over 38 million Americans now fall inside the elevated risk zone. This is BA.3.2, a variant moving faster than any strain detected this year. And tonight, it is still accelerating. BA.3.2 is now confirmed in 22 U.S. states, with the CDC reporting a 3.4 times increase in detection through wastewater surveillance. PCR-confirmed cases remain low, but wastewater readings, the most reliable indicator, have spiked to levels not seen in nearly 4 years. Some counties in California, New York, and Florida have already crossed the high transmission threshold. CDC analysts note that BA.3.2 carries 78 separate mutations, including 15 changes linked to immune escape, and one key decision, a return to voluntary testing. That decision has already failed. Most Americans are no longer testing, allowing BA.3.2 to spread almost completely undetected. But here is the detail that tells the real story. BA.3.2 grew because surveillance collapsed.
Virologist Dr. Allison Green from Johns Hopkins said this. BA.3.2 is not dangerous because it's severe. It's dangerous because we stopped watching. And she's right. The variant carries mutations that lower the effectiveness of both natural immunity and previous boosters. Preliminary lab tests suggest BA.3.2 binds to human cells 40% faster than the Omicron family. Compared with the 2022 surge, BA.3.2's growth curve is steeper and its detection delay longer, meaning it spreads for days before showing up in wastewater. In a small lab in Seattle, microbiologist Emily Carver, age 29, works alone over a wastewater sample collected this morning. Her gloves are stained with blue dye as she adjusts the fluorescent microscope. She's been working 11-hour shifts because her team shrank from 14 researchers to 5 over the past 2 years. Tonight, she sees the same pattern she's seen all week, a sharp rise in viral fragments that match BA.3.2. Her routine work has become the frontline warning system, and her exhaustion mirrors the country's surveillance fatigue. The spread of BA.3.2 isn't just a medical issue. Workplace absenteeism has already risen 11% in metro areas. Pharmaceutical companies warn that supply chains could slow again, repeating the delays of late 2021. And hospitals in 3 states report longer wait times due to staff shortages, not patient surges. If the trend continues for 6 weeks, the U.S. could see economic losses comparable to the 2022 Christmas surge, which cost nearly $2.8 billion in workforce disruptions. This is how a mild variant creates severe consequences, through scale, not symptoms. The World Health Organization has issued a variant under monitoring alert. Dr. Pavel Kruger of the European CDC said this. Governments keep saying there is no cause for alarm. The data says otherwise. He emphasizes that the danger is systemic, a weakened surveillance network facing a fast-moving virus. Right now, wastewater tunnels beneath American cities glow with rising viral fragments. Invisible particles drift through crowded subways and shopping malls. Hospitals prepare night shifts with reduced staff. The system is strained, and the air feels heavier. How long has BA.3.2 been spreading? How far has it already gone? And what else is circulating that we haven't seen yet? The virus is not ahead because it evolved faster. It's ahead because the world slowed down. And unless monitoring changes, BA.3.2 will not be the final warning, only the next one.